Good morning. Welcome to Msunduzi Hospice and our contribution to Hospice Week 2022. Hospice Week this year from the 1st to the 7th of May, and our theme throughout South Africa as we celebrate this week is Live Before Dying. And the focus that we wish to bring to this theme is around busting or dispelling palliative care myths. And I think it's very important as we commence this Hospice Week, as we celebrate the work of hospices, as we commemorate the so many people involved in palliative care, our nurses, our social workers, our caregivers, our very important patients and their families, that we begin to understand some of the differences between palliative care and hospice care. And there is a difference. I recall my own experience way back in the late 90s, 1997, 1998, when I was in Ladysmith and Escort, involved with hospices in those communities. In those days, we spoke about terminal care. In those days, we spoke about terminal care for cancer patients, and that really was the origin of hospices in South Africa, the focus of our work for a number of years. Sometime later, with the onset of the HIV pandemic and the increasing number of lives affected and infected by HIV, the work of hospice shifted, and we no longer spoke about terminal care. We began to speak about palliative care. And I think it's important that we understand the difference. Palliative care is really about providing clinical, supportive, medical care over the entire trajectory of a person's illness, whether or not that illness results in death or not. So, for example, with an HIV patient, there is scope for palliative care. There is scope for the emotional support that a person with HIV who is on antiretrovirals and who is going to be on antiretrovirals for their entire lives. They need support. They need the emotional and social care that empowers them to remain on that treatment. For those who are, in the old language, terminal, they need the clinical and emotional support to help them and their families prepare and organize themselves physically, emotionally, legally to experience the dying process. And so yes, over time things have changed. And I'd like to draw your attention to this very simplified diagram on my right. When a person is diagnosed with a life-threatening or a life-limiting illness, they have treatment. And that treatment is this disease-modifying treatment, curative treatment, treatment that you receive at doctors, nurses, clinics, at hospitals, etc. But even at the point of diagnosis, palliative care is relevant because as human beings, as people, we are more than just our bodies. And so whereas a Panado may take away a headache, some counseling may help us to prevent further headaches. And that is where palliative care comes in. And the value of palliative care is as a supportive role to the curative treatment that people have. And over time, the ratio of curative treatment to palliative care changes as we go through the trajectory of our illness. And this is applicable to all illnesses, even surgery. Palliative care is necessary. At some point in the trajectory of an illness, that person will be told or will be informed that there is no longer any treatment available. In other words, this curative treatment diminishes rather rapidly. And that is when we begin to move from discussions around palliative care to hospice care. The work is very similar. Really, it is the intensity of interventions that changes. And so, as we commence this week as we begin to explore Hospice Week and the work of hospices in South Africa. Let us understand that while we call ourselves hospices, in reality we are centres of palliative care service delivery, centres of palliative care excellence, and we pride ourselves on our ability to provide palliative care to our patients. Our only limits are resources. Do we have the money to pay for those services? And time. Have our patients come to us early enough so that we are able to provide care over the trajectory of their illness and not just here at the end of their lives. You will also hear this week around bereavement support, and our social worker Letitia will explain some of the services we offer as part of our bereavement services. When asked, what do we do? I like to respond that Hospice, Msunduzi Hospice, is about helping patients and their families through specialized care, that's palliative care, to live and to die well. And so we thank you for your support, we thank you for your time, and we wish you well. Thank you.